Forensic Psychology and Forensic Risk Assessment. Brown and Singh 2014 described forensic risk assessment as the likelihood of antisocial behavior, either as a first-time offense or as recidivism. What risk assessment does is a structured examination of risk factors, which are psychological, biological, or sociological characteristics which increase antisocial behavior. Secondly, they look for protective factors, which are psychological, biological, or sociological characteristics that decrease antisocial behavior. The assessment also checks whether these factors are static, acutely dynamic, or stably dynamic. Examples could be a dynamic risk like stress, a static risk of history, like a history of violence, and a static protector factor like intelligence. Gold 2013 examined the risk factors for gun violence and found a correlation between the prevalence of guns and gun violence. What is more poignant is that even after controlling for socioeconomic factors, states with stricter gun control laws had fewer firearm-related fatalities. This data also correlates globally, with results showing how after Australia and the United Kingdom further restricted gun ownership, there was a drastic reduction in firearm-related fatalities. When discussing further risk factors, mental illness was not found to be a prevailing factor for committing acts of violence. Gold 2013 goes on to argue that public health interventions should focus on the dangerousness, with and without mental illness, and the risk of dangerousness. Risk assessment in forensic psychology has proven to be beneficial in community safekeeping. Stinger 2022 documented how in 2020, in California, J. Reed Malloy, a forensic psychologist and threat assessment researcher, was called in to assist in the case of a man who had posted messages on social media that alluded to a violent attack. With the risk assessment, it was found the man was struggling with social isolation, as this was occurring during the COVID-19 lockdowns, and was connecting with political extremists online. After he was deemed to be a threat, police found he possessed illegally modified assault weapons and had online searches looking for the locations of political figures. The man was transferred to a psychiatric facility, and after his stay, he was partnered with a psychiatrist trained in forensics, and he relocated to the Midwest to be close to family. Risk assessment helps stop a potential mass shooting. Though mass shootings don't comprise all of the gun violence, it is facilitated by lenient gun control laws. Through an analysis of mass shootings, it was found that 42% of shooters had experienced early childhood trauma, physical or sexual abuse, exposure to violence, bullying, witnessed domestic violence, or had a parent commit suicide. Over 80% had recently experienced some kind of crisis before the event, whether it be days, weeks, or months prior to the event. Crisis events would include being fired from a job, loss of romantic relationship, or suspension from school. Stinger goes on to state how to keep communities safe, we can keep communities safe by teaching threat assessment in organizations or schools and showing communities how to support high-risk individuals. They also teach how to gather information and teach communities when they should notify law enforcement. As gun control has worked in other developed nations, as stated in social psychology and the cross-cultural psychology section, there is something that can be done now with the laws that we have in the U.S. to keep the community safe from gun violence, while we still have unrestricted access to high-capacity weapons.